All right, ever catch yourself checking out someone's teeth? Like they're practically gleaming. Makes you wonder what kind of magic they're using.
Ah, it's like we're hardwired to notice a bright smile.
Totally. But then there's the flip side. I remember this one time. I had this tiny black spot on my tooth, drove me nuts. I swore I spent the entire day trying to hide it. Turns out, these little black spots, they're way more common than we think, and not always as simple as, like, a coffee stain. So we're doing a deep dive on black spots on teeth,
Yeah.
getting into all the nitty-gritty.
Yeah, these black spots, they can be a real head scratcher sometimes. It's kind of like detective work, figuring out where they came from, because it could be anything, really. Your age, something you ate, even a medication you took years ago.
See, I always just assumed those black spots were from, not brushing enough. Like a badge of shame for my coffee addiction.
Haha, yeah, that's a common one, but it's not always so straightforward. Sure, things like coffee, tea, red wine, they can stain your teeth. But that's usually surface level stuff. We're talking about those deeper, more stubborn black spots, and those can have a whole other set of culprits.
So it's not just my morning coffee I gotta blame. Okay, spill the beans. What else could be causing these mysterious spots?
Well, let's start with the one thing we can't outrun, good old Father Time. As we age, our enamel, that hard protective layer on our teeth, it naturally thins a bit.
Makes sense.
And when that happens, the dentin underneath, which has this kind of yellowish tint, it can start to show through. So sometimes those black spots are just, a sign of a life well lived, like those laugh lines we earn over the years.
Okay, so I shouldn't freak out if I see a spot or two.
Exactly. Now, here's something that might surprise you. Fluoride. The stuff that's supposed to be good for our teeth.
Yeah.
Well, it turns out even too much of a good thing can backfire, especially for kids. If their teeth are exposed to excessive fluoride while they're still developing, it can lead to a condition called fluorosis.
Fluorosis, what's that?
Basically, it can cause these white spots, or in some cases, those darker spots, on the enamel.
Huh, who knew?
It really highlights that even with things we think of as beneficial, it's all about balance.
Moderation is key, I hear. Yeah, so we've got age, fluoride. What about, tobacco? That can't be good for your pearly whites.
You're preaching to the choir. Tobacco is a major culprit behind those stubborn black spots, whether you're smoking it or chewing it. It's those staining agents that really get in there and bed themselves deep in the enamel.
And I'm guessing those stains are tough to get rid of.
You got it. They're notoriously difficult to remove. Just another reason to kick that habit to the curb, bro.
For sure. But what about things we might not even realize are affecting our teeth? I'm talking medications. Can they leave their mark too?
They sure can. Certain medications, like some types of antibiotics, they can actually discolor teeth, especially if you take them during childhood when those teeth are still developing. Tetracycline is a big one. It can cause those black or grayish streaks on the teeth. Now, not everyone who takes these medications will experience this side effect, but it's something to keep in mind, especially for parents.
It's wild how connected our mouths are to the rest of our body. Like, I never would have thought a medication could have that kind of lasting effect on my teeth.
Right. It's all connected. Speaking of which, our research uncovered this fascinating link between black spots on teeth and celiac disease.
Celiac disease, wait, like the gluten thing?
The one and only.
Okay, I gotta ask, what's the connection?
Well, celiac disease is an autoimmune disorder. When someone with celiac eats gluten, it triggers this immune response that damages their small intestine. And get this, that damage can actually mess with your body's ability to absorb nutrients properly, including the ones that are crucial for healthy teeth.
So basically, because celiac disease can prevent the body from absorbing nutrients, it can affect how our teeth develop, and that makes them more prone to these black spots.
Exactly. It's like our bodies are trying to send us a signal. In some cases, those black spots might be an early warning sign of something bigger going on.
That's incredible.
Yeah.
It really makes you think twice about what our bodies are trying to tell us. This is why I love these deep dives. Always something new to discover. But, okay, let's say you've got one of these black spots staring back at you in the mirror. What can you actually do about it? Like, I'm ready to evict these blemishes.
Before we launch a full-scale attack on these black spots, we gotta think like detectives, right? Figure out what's causing them in the first place. Like we've been talking about, there's a world of difference between, say, a surface stain from your daily coffee and a deeper issue, something like medication or even celiac disease.
Okay, so how do we play detective with our teeth? What's the difference between a simple stain and something more serious?
Honestly, your best bet is always going to be a trip to the dentist.
Makes sense.
They've got the expertise, they've got the tools, they can really give you a proper diagnosis.
Yeah, they've seen it all.
Exactly. Plus, they'll take your medical history, look at any medications you're on, really get to the bottom of things. And once you know the cause, you can start exploring the right treatment options for you.
Can't argue with that. So while I'm waiting for my appointment, any chance I can try some at-home remedies for those surface-level stains? The ones that make me feel like I should have invested in a reusable straw for my iced coffee.
Absolutely. There are definitely some things you can try at home. One of the oldest tricks in the book is baking soda, like we used to make volcanoes with back in science
But
class.
yeah, good times.
It's got that gentle, abrasive action that can help scrub away surface stains.
So that's my grandma's secret weapon. She always swore by baking soda for everything.
Haha. Well, your grandma was onto something. But when it comes to your teeth, stick with a toothpaste that's ADA approved.
80 approved. Okay, got it.
Yeah, that's key. It means the product has gone through all the necessary testing, so you know it's safe and effective.
No DIY concoctions. Got it. So, ADA approved baking soda toothpaste? Check. Anything else I can add to my routine?
Hydrogen peroxide toothpaste is another good one. It breaks down those chemical compounds that cause staining. Kind of like a little bleaching agent, but again, look for that ADA seal of approval.
Double the whitening power. Baking soda, hydrogen peroxide.
Yeah.
Anything else we can throw at these pesky stains?
Don't forget about mouthwash. And here's a little tip. Use it twice a day.
Wait, really? Twice a day?
Yep. Most people swish and spit in the morning, but that second round, after you brush at night, that's what makes all the difference. It helps neutralize acids and keeps those stains from setting in while you sleep.
Huh. Who knew? I've been slacking on my mouthwash game. Okay, so let's say I've tried all the at-home remedies, and those black spots are still hanging on for dear life.
Yeah.
Is that when I wave the white flag and head straight to the dentist's chair?
You got it. Sometimes those home remedies just don't cut it, and that's where a dentist comes in with their professional-grade solutions. One option is dental bonding.
Dental bonding, what's that?
So imagine a tooth-colored resin, kind of like putty, that gets sculpted onto your tooth, and then they use a special light to harden it instantly. It's like a mini makeover, restoring your natural tooth color.
Oh, so it's not just covering up the spot, it's like actually fixing it. That's amazing. What about veneers? I've heard those are an option too, right?
Yeah, veneers are like custom-made covers for your teeth. Thin shells, usually made of porcelain, that get bonded to the front. And they're great for masking imperfections, like those stubborn black spots we've been talking about, especially for those front teeth, the ones we're always showing off.
It's like giving your teeth a whole new wardrobe. Okay, that's bonding and veneers. Anything else, or have we covered the all-star lineup of treatments?
We've got one more trick up our sleeve, microabrasion.
Micro what now?
Microabrasion. It's a bit like sanding down a piece of furniture to remove imperfections. The dentist uses a special instrument to gently polish away a thin layer of enamel. It sounds scarier than it is.
So it's like hitting the refresh button on your enamel.
Exactly.
Wow, so many options. I had no idea there were so many ways to tackle these black spots. This whole conversation about treatments makes me want to just prevent them altogether.
Now you're thinking like a dentist. Prevention is key.
So spill the tea, or should I say sip the water. What's the secret to keeping those pearly whites, well, pearly white?
It all comes down to good oral hygiene.
The classics never go out of style. But, beyond brushing and flossing, any secret weapons in the fight against black spots? You got any insider tips for us?
Well, remember those foods and drinks we talked about? The ones packed with pigment.
You mean like my beloved coffee?
Ha, exactly. You don't have to say goodbye to them forever, but being mindful about how often you enjoy them can make a big difference. And maybe chase them with a glass of water just to help rinse away those staining agents. Little things like that can really add up.
Okay, so moderation, not deprivation.
Yeah.
Love it. Now, what about those whitening strips? Are those a good preventative measure or more of a Band-Aid solution?
Whiten strips can definitely be a helpful tool.
Okay, good to know.
They can be really effective at removing those surface stains and brightening things up. And the great thing is, they're easy to find. You can grab them over the counter at pretty much any drugstore. But, and this is big, but you got to make sure you're following the instructions, to the letter.
Got it.
Using them too often or for too long can actually weaken your enamel.
Yeah.
And that's going to make your teeth more vulnerable to staining in the long run. It's like with anything else, too much of a good thing can backfire.
Duly noted. I won't go overboard with those whitening strips. Our research also mentioned something called a water flosser. What's the deal with those? Is it just a fancy way to floss? Or is there something more to it?
It's definitely more than just a fancy gadget. Imagine a tiny pressure washer, but for your teeth.
Okay, now that's got my attention.
It uses this stream of pulsating water to blast away food particles and plaque. And the cool thing is, it can reach those tricky spots where your toothbrush and regular floss might struggle to get to, especially near the gum line. And since plaque buildup can lead to those black spots, a water flosser can be a real game changer when it comes to prevention.
A pressure washer for my teeth, I'm sold. You know, it's amazing how much we've learned about these seemingly simple black spots. It really makes you appreciate how complex our bodies are, even down to the tiniest details.
Absolutely, and the more we learn, the more we realize how much more there is to discover.
So true. Well, this has been an eye-opening deep dive into the world of black spots on teeth, that's for sure. I
Yeah.
feel like we've all leveled up our dental IQ today. A huge thank you to you, our amazing listeners, for joining us on this journey of discovery. If you enjoyed this deep dive, don't forget to subscribe to the show and leave us a review. We love hearing from you. Until next time, keep those pearly whites shining and those curious minds exploring.